Hi, I'm Kenny Anderson, Director of Multicultural Affairs for the City of Huntsville, and welcome to Impact. We're glad that you've joined us today for a wonderful discussion on a topic that I know will be of some great interest to you, because every time I talk to these guys, they've got some great information to share. And if you have not talked to Jim Pride or David Hereford yet with Good Samaritan Hospice, you are really in for a big treat today. Introducing them right now. Jim, how are you doing?
I'm doing fine, Kenny. Thank you so much for having us here.
It's great to have you. And like I said, every time we get together, there's something good happening.
Right.
And we're going to get a chance to talk about some of those good things today.
Perfect.
Jim Pride, of course, is Director of Community Relations with Good Samaritan Hospice and a strong supporter of our community. And we'll talk a little bit more about that in just a moment.
Great.
David, how are you doing?
I'm doing great, Kenny.
That's awesome. It's good to see you. David Hereford is the Director of Marketing for Good Samaritan Hospice, and it's always a treat to be able to talk to you as well.
Well, thank you.
You know, we're not unacquainted with each other, and I think that's the coolest thing about doing the show today, because a lot of times you have guests and they've contacted you about coming on the show and talking about something, but we've actually had a chance to build a relationship through working at WJOU on the broadcast that I do over there, and the work that you guys do in the community as a result of Good Samaritan Hospice. And I really want to talk about why that's so essential today. Not just the work you do, but the partnerships that you have, and why that's a win-win situation for everyone in this community. And this show is committed to shining a light on positive things that are happening. And I think that we're really going to talk about a model for success today through what we're going to share with people. But first of all, let's start with Good Samaritan Hospice. We do feature conversations on hospice from time to time. And Jim and David, we were just recently at a big Alzheimer's event, got a chance to talk with you there.
Absolutely.
And Good Samaritan just keeps popping up on the scene of good things, so that must mean that good things are happening. A few weeks before that, big event at Oakwood University with a big health fair that you guys helped to co-sponsor. And so you guys are on the scene helping people know the value of hospice. So let's talk about what Good Samaritan Hospice represents to this community.
Well, Kenny, first and foremost, Good Samaritan Hospice, we're a locally owned and operated business. And so we feel like it's our obligation to give back to the community. So many people really don't know what hospice is about. They hear about hospice, they may have had a loved one served by hospice, but David and I both feel strongly about getting out, educating the community, letting them know the benefits of hospice and that it's available to everyone. We do this in a variety of ways, but of course the community involvement is what's near and dear to us. We like to get our message out, but we want to make sure that we're helping people and providing good information at the same time.
Yeah, and that's important, that whole combination of not just being a product, but being a product that people understand and also have access to. And David, I know your role as marketer for the organization, you get a chance to talk to a lot of people about the services that you provide. Talk about why that's important, especially from the perspective that in 2014, and this is surprising, a lot of people still don't really understand and appreciate hospice for what it is.
Absolutely. And one of the things that Jim was saying, that, you know, when we go out and we educate the community, that's what we do. Because in this day and time, it's a service that you don't know you need it until you need it. And unfortunately, we have found that a lot of people will come on hospice sometimes a little too late. And what I mean by that, they can still have the services, but the family members, you know, they'll get more of the benefit than the patient, because the patient may unfortunately pass away when they come on. So what we like to do is like to educate the family members and the patient by saying, hey, listen, once you get that terminal diagnosis, give us a call. And we can help. You know, we have nurses, skilled nurses that can help navigate you throughout this process, because this is a process that you don't come in contact with until you really need it. And so that's one of the things. And also what Jim had mentioned earlier about we're locally owned. Janet Milton is our owner, and she's a registered nurse. And she has skills in hospice, and also we have Dr. Butler there on board, and we can actually look at and see exactly what that patient may or may not need.
And you know, that makes a huge difference, I think. The idea that this is not an entity that's located somewhere in Wisconsin, perhaps, or in South Dakota, or even in Georgia or Birmingham, for instance, you know, but you're right here in this community, homegrown, home operated, and able to keep your eyes and ears on what this community needs. And that's got to be a real strong selling point for your organization.
It is, Kenny, exactly, because we're located in Madison, but we serve all of North Alabama. And as David mentioned with Janet Melton, who is our owner, and along with Kevin Hurd, Janet, what sets us apart, she's not an absentee owner. She's there in that office every day, talking to patients, talking to caregivers, making the crucial decisions that help these folks. Yeah. And we often say that in the end, we believe that we've done as much for that family as we have for the individual who is suffering from the terminal illness.
Right, right.
Absolutely.
I've made it no secret to you guys and anybody else that I talk to about hospice. I absolutely love hospice. I love it as a human being. I love it as a mental health professional. Mm-hmm. I love it as a person of faith. I mean, I love it in so many different ways for so many different reasons. But a lot of times when you bring up the subject of hospice, I get the deer in the headlight look.
Oh, yeah.
And people don't really know, isn't that thing about dying people? Yeah. You know, it's kind of like they look at you kind of curious, like, no, I really don't want to either talk about it, or they get uncomfortable when you start, really discussing certain kinds of things. I want you to demystify hospice for us. This is a tall order, but I know you guys can handle it. Demystify it for us so that we can really understand the value that it provides for people in need of the services.
David, you go ahead.
Oh, okay. I think one of the best ways to do that is to paint a scenario. Let's say you're a patient and you're in the hospital. Now you just got that terminal diagnosis. And what I mean by terminal diagnosis, that means the doctor has come in and said you have 6 months or less to live. Now, when you first get that diagnosis, a lot of times you're scared because you don't know what to expect. Sometimes that's a totally new diagnosis. And other times you could be battling with cancer or a disease such as cancer, and it has gotten worse. So what do you do? Well, that's when hospice, when we come in, we'll say, okay, that person needs equipment at home because you don't have a hospital bed. You didn't imagine you would ever need a hospital bed. We can provide that equipment for you. We can go in and make sure that you can get your medicines delivered for you. A lot of times we have senior citizens taking care of other senior citizens. And, grandma can't get out to the pharmacy and get medicines. We have nurses that can do that. So those are little bitty services, and a lot of times people don't really realize that. Sometimes a family member, they need to just be able to grieve, just experience those last moments with their family without seeing the dignity. I used to do social services, and we used to always talk about dignity, and that patient needs to pass on with dignity, to be dignified in their passing, and that's what we allow. We comfort so you can die, or so you can pass on, transition to another state.
Yeah, and that notion of dignity, Jim, I'm sorry, the notion of dignity really elevates the person's humanity and really puts people in a position where they're not cast-offs because they have a terminal illness, but they are going to be fully respected, whatever the outcome. Because again, the diagnosis may be terminal.
Absolutely.
But things could happen.
Absolutely.
Well, and that's so right. And the main thing to remember is that hospice allows that patient to do what's most important to them.
Yes.
You're not concerned about the bills. Hospice takes care of everything. Once you receive that diagnosis, hospice is a federal benefit that all Americans are entitled to. So if you need a hospital bed, you need a bedside commode, you need a walker, you need oxygen, all of your medicines and medical equipment that are related to that hospice diagnosis are covered under hospice. And you've got an entire team caring for that individual and family. You have, back at the office, we've got Dr. Tanya Butler, who is our clinical director. We have Dr. Zia Hassan and Dr. John Wagner, who are our medical directors. Then each patient has an RN, which is the case manager. She is the liaison between the hospice provider and the family. Then you have CNAs, which are certified nursing assistants, help the patient with personal needs, bathing, changing bed linens, things like that. And then we have social workers that check on the psychological needs of the patients and make sure that they're in a good spot. But one of the most important things that we have that I believe is one of the most important services is our chaplains. These guys come in, they minister to the family, to the individual, and even if we're dealing with someone who for lack of a better term, does not have a religious background. If you want to talk football, these guys will talk football with you. Whatever you want to talk about, and quite frequently, and I know David would back me up on this, you'd be surprised how many times our chaplains end up doing the final services for these individuals.
Wow.
They've grown so close to that family and that individual that that's how much they're respected in that household.
Right, right.
That is so true.
Before I move on to your work in the community, which I think is a very important thing that we want to make sure people are aware of, I want to once again emphasize that when that terminal diagnosis comes along, which I think is what suspends and scares suspends some people's conversations and scares others away from having the conversation. We're a death-denying society. There's no question about that. We spend more time thinking about living than we plan for dying. And the inevitability is that the last time I checked, there are no 1,000-year-old people living on the planet. And so it's going to happen, you know. And in the same way that I invest in my automobile to make sure it's taken care of, the same way that I invest in my home to make sure that if there's some kind of an accident or incident, I can replace my home, I also want to be prepared for when I die, because it's going to happen.
That's true.
And there are ways to do it that honor dignity and respect, that help you to deal with the grieving process, because the last thing you really want to do when somebody is dying or has died is face the preparation process for that, because you haven't even had a chance to grieve.
Exactly.
And so now you're feeling overwhelmed. And so hospice steps in, and as Jim and David have explained, you've got this whole range of services that covers the whole person.
Right.
And people who are running around thinking, you know, I don't know what I'm going to do tomorrow, or they feel overwhelmed, and perhaps now they're the caregiver, they're depressed. And we talked with the people from Alabama Respite just a few weeks ago on this broadcast. Had a great conversation about how they step in and combine with Alabama Respite or hospice or some of the other support services in town. People have a way of getting the services that they need. They just have to reach out and
reach out.
There are answers to those problems, and quite often, if we cannot provide the exact service that this family or individual needs, we know where to point them.
Yeah,
we're going to get somebody over there to help them.
Yeah.
And you mentioned Alabama Respite. That's another thing that hospice provides. Quite frequently, caregivers need a break. Whether it's to a family wedding out of town, a grandchild getting married, and or just need a break.
Just a break.
Just a break.
We work with many different local skilled nursing facilities where we can take their patients in for a week, a few days like that, to give these caregivers a break, and the caregivers can do what they need to do. And know that their loved one is going to be taken care of.
Yeah,
because we're still going to be watching after them in the skilled nursing facility.
Yeah, boy.
Absolutely. And one of the things that we like to tell people is that hospice does not mean that you've given up on your loved one. A lot of times, you think of hospice, the old hospice back in the, because of miseducation, a lot of folk thought, well, if I go on hospice, I've given up. That's not the case. It's just that now they're at a different stage. You're at a different stage of your illness now. And it does not mean this person's going to pass away. We've had people on hospice who've actually gotten better and came off of hospice.
Wow.
Yeah. So we don't say that our patients are going to pass away. That's not, we're just helping them at this point in their life when they're going through this stage. And this may be a stage where they bounce back out. They may need our services again. And one of the things that me and Jim, we tell people in the community that you're on hospice today, you can always come off hospice and use us again if you need us. This is a service that will not run out. It's there for when you need. You can get better, come back. And it's the same thing with, and it's good to have that extra friendship. A lot of times, when you're battling things like cancer, I'm a cancer survivor, and to know that, hey, I have an oncologist, I have a team that's waiting for me to answer questions for me if ever I need them again. And that's what hospice does. We're there. So you went through that hard thing with us. We became friends with you. When we tell people in the community, sometimes after a person has passed on, we'll follow them up to a year, sometimes over a year. And we just, how are you doing?
Yeah.
How's everything going with you?
Yeah.
Yeah.
Knowing that you have that support makes all the difference in the world sometimes, and that's exactly what hospice represents. Jim Pride and David Hereford, we're talking with these guys today regarding the work that they do with Good Samaritan Hospice. And it'd be one thing if you guys were providing a great service to the community, but you go far beyond that. You now have your tentacles out into lots of parts of the community where you're touching and reaching people. Everywhere I go, I'm seeing Good Samaritan Hospice, and that's a good thing.
It is.
Because I know when we first met, that was a goal you guys had, and it's actually being realized right now, and that's just a wonderful thing. And in fact, you guys don't know this, I'm really part of the team.
You are. You are.
No doubt. No
You
doubt.
are. No, we know that. We know that.
And it's just great to work with you all because you do such a great job, and I'm really, I think that this community benefits so much because of that. But talk about some of the partnerships. I mentioned that you helped to sponsor the big community health fair at Oakwood University for the second year, bigger and better than ever. It's going to be even bigger next year, I know. You guys are just really making an impact in that kind of way in terms of community partnerships. Why is that important? Why is that happening? And then why is that important for you as an organization?
Well, one of the things when we decided to partner with Oakwood, you know, they're such a pillar in the community, and they have such a respectful reputation, and as we do, and so we found that would be a good partnership. Also, they had never had a health fair, nor had we on this level, and we want to make sure that we can put our resources together. Because it's one thing to have something that people can use, but nobody knows about it. So we want people to know what we're offering. And like you said before, last year's health fair, this year's health fair was bigger than last year's, and we want to continue to grow. One of the things that we do as we go out through the community, we speak a lot in doctors' offices. We'll go in and we'll talk to doctors in nursing homes and assisted living. And we want those people to know that we have a service that they can use. And we don't want them to be shy about calling us. And the thing with Oakwood, there's a lot of one of our chaplains. He's very popular at Oakwood, and I was talking to him today in the office earlier today, and he said, I got another call from somebody that he did not know. They said, I hear your about your connection that you have with WJOU, and I think Mom needs the services. Mom needs the services, and from that point on, we're actually going to come out and look at that patient.
Wow.
Yeah.
Wow.
And that's the great part about it is all you need to do is just call us.
Yeah.
And it may be that your loved one is not hospice appropriate, but we're going to follow you and we're going to be there for you in case that time does come. One other thing I would like to quickly mention about our health fair was the great thing about that health fair is we were able to provide 3 scholarships this year for deserving Oakwood students. Based on the proceeds from last year's hospice. Good Samaritan Hospice, Kevin and Janet graciously donated a matching amount, so we were able to double those scholarships. Talking with Ron Gilbert over at WJOU yesterday, and all of we did very good on this year's scholarship, but 100% of the proceeds goes into this scholarship fund. There's nobody taking any money away from this. It's all going to benefit some deserving students over there. And I know you were there, Kenny, when we awarded those scholarships, and seeing the smiles on those kids' faces, they knew they were told to come over there, but they didn't know why.
Right.
And when they found out they were getting a scholarship, it was great.
They were so excited and so appreciative and so gracious in accepting this thing being given to them, and they were just so humble as well. It's just great to see that kind of thing, which is why I said this is such a great model. Here you are, business in the community, providing a resource. You're in business, but you're also providing this great resource, and then finding ways to collaborate with the community that makes sense. You talked about Oakwood being the right partner. You wouldn't just partner with anyone in the community, but you found a right partner, and not only did you find a right partner, but that right partner now has a vehicle that you can connect to their purpose, which is education and providing opportunities for young people. And so, the circle remains unbroken that way.
Exactly.
Pouring and reinvesting into that process, and it makes a big difference for everybody.
Yes.
And I think that's what you all can really be commended for.
Well, thank you. We appreciate that. And I'd like to say, too, that our ownership, again, Janet Melton and Kevin Hurd, they're the ones that allow us to get out and do this. It's not strictly about marketing Good Samaritan Hospice to the community. It's it's about giving back and doing good things for the community.
That's right. And Janet and Kevin, of course, obviously have a big vision for this community that is represented by a great care for people and a careful and conscientious consideration of what is needed in the community. And I think that is so important. You've got the right leadership that supports the right initiatives, and as a consequence, it's a win-win situation for all.
Yes, absolutely.
And, you know, and what Jim was saying also, you know, because we, ITT Tech, we have their students come in and they do their internship with us a lot of times because we want to make sure that even they know, because Janet, you know, she is so instrumental in getting out, educating people on, you know, just nursing services. A lot of times, I was in the office earlier this morning, and we have CNA, you know, certified nursing assistants who have, you know, they were going out being trained by more experienced nursing assistants. So it's always a training process going on, and we're doing a luncheon for social workers and discharge planners later this week, and at our offices, and we went into, you know, invite any social worker or discharge planner to come by. But one of the things that we're doing there, we're educating. We're doing a CEU, continued educational unit, for these individuals, so they can walk away with something. They'll know what we do, and they'll also get an opportunity to see our facility. We also do an open house, and in that open house, we just invite the community, our healthcare professionals, to come in and take a look at us, ask us some questions. You know, and we'll answer them for you, or find somebody who can answer them.
And I'm sure you'll be able to do that. I think it's great that you have the ability and the foresight as an organization to say, you know, again, we're not just going to exist, but we're going to really look for meaningful ways to connect with the community. Here you are providing internship opportunities for students who are saying, I want to do this with my life. This is my career choice. Gives them a chance to really get in there and see if that's for real. Is this something I really want to do for the next 10 to 15 years of my life?
Yes, yes.
You know, what is it like to be engaged in hospice, you know? And so that's so important to be able to provide those kinds of opportunities to work with other professionals in the community and give them a sense of what's going on, and also just the general public, you know?
Absolutely.
Well, and that's a great point, because I would like to give a shout out to our nurses, and I always say, if you are a nurse, there's a whole lot easier way to make a living than as a hospice nurse. But these ladies that work for us, they take this to their heart. They become part of that family. You know, they're the Rock of Gibraltar when they're at that house. Wow. And we see them when they come in the office. They let that guard down a little bit, and you can tell how much they love these people and how much they care for them. So being a hospice nurse is definitely a special calling.
Wow, wow. Well, Good Samaritan Hospice is certainly making a difference in this community, and I'm thankful to have had this opportunity, the first of many, I hope, to be able to talk to these guys about what's going on with this organization. My partners. So my partners right here.
You know, one of the things that we want to mention, you know, in our health fair, we always look into the community and try to find someone in the community that's doing something special. So this year we had to give Kenny Anderson the award, the Good Samaritan Award, because I mean, you've done so much in the community, Kenny, and you continue. While we're out everywhere, we see you everywhere.
Yeah, exactly.
Well, thank you, and I graciously accepted that, and that's one of many awards that are in my office at this time, but it's the only one actually sitting on my desk.
Oh, good, good.
Sitting right next to my computer, man. That's a very special award from a very special organization. Tell people about your website and phone number so they can get more information.
Okay. Well, you can go to www.gshospice.com, or you can call us at 256-772-8108. If you go to our website, you'll see that we've got a list of the 10 most common asked questions, 10 common misconceptions, but that phone number is also very important, because we have got a staff there, Brooke Grosheim, who's the office manager, and a social worker, Dr. Tanya Butler, and of course Janet Melton, RN. If you have any questions concerning hospice, call us. We're glad to talk to you.
Give us that website and phone number one more time.
www.gshospice.com. Phone number is 256-772-8108.
Jim Pride, Director of Community Relations, and David Hereford, Director of Marketing. Thank you guys for being here today.
Thank you for having us, Kenny.
For a great conversation. We appreciate that.
Thank you.
We want to thank you for being a part of our broadcast today, and we invite you to join us for the next edition of Impact coming soon. In the meantime, have a great day, and we'll talk. Take